All right, so for today's Teach Me Something, I have burn injury. What I have made here is a fake me out burn. This is going to simulate a superficial partial thickness burn. It involves it's a deep injury into the dermis, but blood supply is reduced. As you can see, it's a little red. Large blisters may cover extensive areas, hence my blister in the middle. Edema is present. It's pink and molted. Some of it's broken with a wet and shiny weeping surface as a characteristic. The burn is obviously painful. It's sensitive to cold air. It heals in about 10 to 21 days with no scarring, but some minor pigmentation changes can occur, and this is what I would teach my patient at discharge. And then I'm also going to simulate in this video how to care for this wound. So at first, prior to discharge, I'm going to teach him how to dress the wound. It's already been debrided and everything, so this is strictly just teaching him how to change the dressing. So we're going to start off. I have some petroleum gauze to keep the burn wet. You wouldn't want it dry because when they go to change the dressing, you'll remove the skin cells from the top of the burn once it starts to heal. So I have a petroleum gauze, and then I also have some cling that we're going to tape up. Again, this would be also done sterilely. I don't have all the sterile equipment here with me, but I would teach the patient that. Main thing with this is you want to reduce infection and promote healing. Okay, so I'm going to apply the wet petroleum gauze on top first. Lightly pat it so that it stays, but of course reduce to just be careful to not injure your patient more. I also personally like to just add some gauze to the top of it. This kind of helps as like a barrier because this is also in a difficult spot on my patient. It's in his forearm. So this is typically a spot that gets whacked a lot, so it's easier. It's best to have like some sort of like a comfort barrier. Okay, I'm gonna have you pick your arm up for me. Thank you. So also prior to dressing your patient's wound, you would do an assessment, figure out where the burn occurred, how it occurred, if it's chemical or if it's mechanical. Also location. So with this gentleman, his is in his forearm. So like I said earlier, it's in kind of a rough spot because it's easily hit, especially in the winter months. We have long sleeve clothing that can cause like some lint in there, so you definitely want to keep it closed at this point in the game. And then I also have, he will also probably, but depending on the burn, this one again not so terrible, but they can go on prophylactic antibiotics to prevent infection. And that's pretty much it. And then for pain control, we would just recommend Tylenol, ibuprofen around the clock until the pain subsides. And then if they were to, I would also teach my patient that if they saw any sort of yellowing exudate coming out of the wound, or if they felt that it was getting more inflamed and the pain increased, to return back to either the emergency room or call your PCP, because it could be potential for infection. And other than that, that would be it.